So residents who come through the Kaiser Permanente system for their training, I think will get a very holistic picture of what healthcare is. They're not just looking at what they do in the office, but they get to see the whole system. And I think that's one of the strengths of being in a Kaiser Permanente residency program. We are very much learner-focused and learner-centered. Being in Kaiser Permanente, we don't really have the requirement to make the hospital run or keep the hospital running. We basically are able to add value and add on with our educational program. And so our residents are really the focus, and what is the best educational experience we can provide for them is really the focus of what we do.
Normally, residency programs are 4 weeks long. Ours is 2 weeks long. So it seems like it's short, it seems like it's quick, but the beauty of it is that you get more repetition. And it's wonderful, I think, for wellness of the residents. You're not feeling like you're bogged down for 4 weeks in a rotation that you maybe don't like so much. The other part that I think is great with our 2-week curriculum setup is that it really meshes well with what it means to be a family physician. So you're almost never going to have a day in real practice where you're only doing pediatrics all day long. You're always going to have a variety of patient types, ages, demographics that you're seeing. And so this 2-week setup with the frequent turnover, frequent repetition allows you to start thinking like a true family physician from day one.
I'm a curriculum director for lifestyle and integrative medicine here. One of the things that we try to do with this curriculum is involve our residents so that we can make it most effective based on what they need to learn in these areas.
And so it's been really amazing to be available to work on the curriculum. Something that I was interested in through medical school was in both integrative medicine and lifestyle medicine. So being able to bring that to the program and to work with the curriculum director and our APD has been really awesome. I think that's very unique to our program where we're able to be involved in such an important part of patient care.
Some innovations that we've implemented, so it's kind of a work in progress, but we're rolling out our POCUS curriculum as we speak. And so we have point of care ultrasound that's happening with our butterfly handheld probes, as well as we have a modular based learning program called SonoSim that we use with our residents. And so those are two unique innovations that we're rolling out.
Family medicine doctors often find themselves stepping into many different roles, whether it's leaders, teachers, advocating for their patients, oftentimes right in the beginning of their career. So Lena and I worked on a curriculum on professional development to equip our residents in order to succeed in these areas.
When we were designing it, we were very purposeful about which topics we selected for the first year, second year, third year residents, so the curriculum actually builds on itself. We try to tackle topics for the interns that would be most applicable for them, and then so on and so forth for the second and third years. And it's also a nice way for all 6 residents in a particular class to come together, so it really helps them foster their relationship with each other and take a step away for a moment from clinical duties and actually focus on bigger picture things that are still very important for their careers professionally.
So I think a big success of our program has been how much hands-on learning we've been able to provide our residents. So not just in the actual hospital and in the clinic, but really with our longitudinal curriculum. So longitudinal is really that you don't just do your 2 weeks, you leave it be, and then you come back to it, but it is something that's ongoing throughout the 3 years. Our residents get to experience community medicine here at Washington Clinic. It is in the heart of downtown. It serves a good portion of underserved and underinsured patients. They also have the opportunity to learn about the services that are available in Santa Clara County to provide your patient with whole health care. It's not just what's in the clinic, but it is their house, it is their food, it is their job. All of those things apply to their health. And so we're trying to give our residents that glimpse.
Our residency really takes the time at least once a month in something called Balance. So it's a structured, facilitated group where we're able to kind of slow things down and process amongst each other and sort of share difficult cases. Whenever we sort of have those moments together and learn from each other, I go home thinking, being really thankful that we have a residency that, speeds us up to the point where I feel competent as a physician, but also slows things down to where I can process again as a human in a profession that can be really emotionally draining. And so those are the moments where I feel really well balanced. I'm driving home. I'm really thankful that I'm part of such a good community.
We're definitely excited to have more people bring in their expertise, their passions, and their personalities to really grow and change our program. I think it's something each year we get a little bit better each time. And we're really excited to bring people of different backgrounds, diversities into our program, because ultimately that's what's going to build a strong residency. We're also one that we're hoping to build a culture of individuals that are passionate about their medical care, but also passionate about building a residency and being kind of the trailblazers for this program.